So, hi everyone. I am here today at Orthopedic Physical Therapy. My name's Amanda Harris. I'm the owner of Re-Kinect, and I am sitting with Tracey Adler, physical therapist and owner of Orthopedic Physical Therapy. And I asked Tracey to talk with us today because we have enjoyed a great referral partnership with your physical therapist here for the last several years. And I think in large part that's probably due to the fact that we have very similar philosophies on, in your case, patient care, in our case, client care. But I'd love for you to tell our viewers what you feel makes orthopedic physical therapy different than other practices that they may have heard of or even experienced treatment from.
Well, first of all, we've been here for 35 years almost. Everybody gets individual care. It's one-on-one. When they come in here, they're not put on a machine or anything like that. We really emphasize evaluating the patient and trying to figure out where the source of their problem is coming from.
Yes.
So even if they're coming in here for jaw pain or foot pain or back pain, we look at the entire body. What they're complaining of is not where their problem started. We do see a lot of chronic pain patients, so that is important to look at that whole history. Because if you just start treating where they hurt, I think you're not going to get very far.
Right, you're just chasing pain at that point,
Right.
which can be exhaustive.
Right. Everybody here is a physical therapist. We don't have any physical therapy assistants, not that I don't agree with that part of the profession, but it's all hands-on here, one-on-one. We do teach people exercises and encourage that, but my feeling has always been that you come here hopefully for our brains and our hands and not the equipment that we have in the office.
Right. In general, and I think you kind of spoke to this in talking about how your practice specifically is unique, but tell our viewers a little bit about the difference between a manual physical therapy practice like this one and what might be termed traditional physical therapy.
So manual physical therapy means that most of what we do is hands-on. It doesn't mean that we don't do exercises or any of that. I think when you go to some traditional physical therapy offices, they might have a couple patients scheduled at the same time so that the therapist is jumping between patients, or there's some assistive personnel helping out, and there might be a couple people out in the gym doing a bike, doing this, doing that, and your time at the clinic is maybe 10 minutes with the physical therapist, even though you're there for an hour, half, or 2 hours. So I think that's also a difference in what we do. When you're here, you're at least 30 minutes with the therapist hands-on.
Fantastic. Now, you are a dry needling guru, and I know you teach dry needling, and that's been sort of a buzzword in the industry, if you will, over the past, well, I guess several years, right? Give our viewers a crash course on what dry needling is and how it could be helpful.
So dry needling actually started in this country in the late, like 1997. The therapist that really brought it to this country, his name is Jan Damerholt, and he actually trained directly with Janet Travell, who is the physician that coined the term myofascial pain, and did some treatments with basically injections for trigger points. Then in about 2003, the first class or so was taught, that's when I took a class in dry needling. At that time, there were maybe 10 of us in the country, and there were only 4 states that allowed physical therapists to do dry needling. So over the past now 15, 16 years, it definitely has exploded. The basic technique is using what we call a solid filiform needle. It is not a hypodermic needle. We're not injecting anything. So the hypodermic needles are also cutting needles versus these needles that don't do tissue damage. They're very small and thin. But like I say when I teach, you can teach a monkey to stick a needle in somebody. So you don't want to put a needle where somebody says they hurt. It goes back to finding the source of the problem. So you want to put the needle where the pain is coming from. So to me, besides knowing the technique of needling, it's using your hands and doing expert palpation to find those trigger points.
Right.
So the trigger points are not necessarily anywhere that you're tender. The trigger point is basically kind of a knot in the muscle, and there's a taut band. So you feel for that taut band, and then along that taut band, within that taut band, you feel for the trigger point. And so it's very specific as to where you're putting the needle. And the more specific you are, and I think targeted with your palpation, the better results you're going to get with dry needling. So it's very rare, if people haven't had dry needling, it's very rare that you bruise or bleed. It's not like getting an injection or something. Typically people feel the deep ache when I put the needle in the trigger point, but initially they don't feel the needle go in. People that are very needle phobic have tried dry needling and been amazed at the results. And so, I don't think it's something to avoid if you don't like needles, because they're very thin. And
right.
So, there's a lot of people out there now dry needling. Not everybody gets the same results. It's like any other technique out there. I mean, you can go to a surgeon for a certain kind of surgery.
Right.
They've all been taught the same way, but there definitely, I think, is the art and the science to the technique of surgery or dry needling or whatever. So
right.
I do think that that's also something that's come about now, that there's a lot more people out there doing it.
So it sounds like you need good assessment, physical assessment technique, you need good manual technique, and then you need the dry needling skill set, I guess it would be, right? So really having that manual physical therapy practice with the dry needling is just the sort of the perfect case scenario for your practice.
Yeah.
Excellent. And that's one technique that you all have at your fingertips, but obviously you're very practiced at it.
Right. Yeah, I mean, dry needling's not going to fix everything.
Right.
Nothing's going to fix everything. It's looking at the whole package and using it as another tool in our toolbox.
Exactly. Great. Well, thank you for your time with us this morning, Tracey.
Thank you.
And if you're interested in learning more about orthopedic physical therapy, you can go to website address?
orthopedicptinc.com. And our phone number is 804-285-0148. And you can look at our website. You can read about dry needling and all the other things that we offer. We also specialize in all different kinds of diagnoses.
Excellent. Thanks so much, and we'll see you soon.
Okay.